Sarah Johnson stood nervously in courtroom 302 of the Oakland County Courthouse, her fingers tightly gripping the worn leather strap of her medical bag. The morning sunlight streamed through the tall windows, casting long shadows across the polished wooden floors. At 35 years old, this was her first time appearing in court, and the weight of the moment pressed heavily on her shoulders. The courtroom was busy that Monday morning, filled with the usual shuffle of traffic violations and minor offenses. Sarah watched as case after case moved quickly through the system, each lasting no more than 5 minutes. Judge Michael Thompson sat high on his bench, his silver-rimmed glasses reflecting the harsh fluorescent lights as he handled each case with mechanical efficiency. Case number 47,823, Sarah Johnson, the court clerk called out, her voice echoing through the high-ceilinged room. Sarah stepped forward, her sensible black shoes clicking against the floor. She had chosen to wear her most professional outfit, a navy blue blazer over a crisp white shirt and matching skirt. Her natural hair was neatly styled, and she carried herself with quiet dignity despite her racing heart. Judge Thompson barely glanced up from his papers as she approached the podium. At 58, he was known throughout Oakland County for his strict interpretation of the law and no-nonsense approach. His salt-and-pepper hair and stern expression gave him an air of authority that made even seasoned lawyers nervous. Ms. Johnson, you are here today regarding a parking violation at 1247 Mason Street on April 15th. The ticket indicates your vehicle was parked in a restricted zone for approximately 45 minutes. How do you plead? His voice was flat, uninterested, as if he'd said these same words 1,000 times before. Sarah cleared her throat. Your Honor, while I acknowledge parking in the restricted zone, I believe there are important circumstances that need to be considered. Ms. Johnson, Judge Thompson interrupted, looking up for the first time, his blue eyes cold. This is a simple matter. Did you or did you not park in a clearly marked restricted zone? She took a deep breath, trying to keep her voice steady. Yes, Your Honor, I did. But I was helping Mrs. Dorothy Williams, an 82-year-old patient with severe mobility issues, access the community health clinic. The designated parking spots were full, and Mrs. Williams couldn't walk the extra 2 blocks from. Ms. Johnson, the judge cut in again, his tone sharp. The sign clearly states no parking at any time. The reason for your violation, while perhaps well-intentioned, does not change the fact that you broke the law. Sarah felt her face grow warm, but she stood her ground. Your Honor, in my work as a healthcare advocate, sometimes we face impossible choices. Mrs. Williams had an urgent appointment for her diabetes management and... Judge Thompson raised his hand, silencing her. The courtroom had grown quiet, other waiting defendants watching the exchange with interest. The morning sun had shifted, casting half of the judge's face in shadow as he looked down at her. The law is not about choices, Ms. Johnson. It is about compliance. Your work, whatever it may be, does not place you above the law. He shuffled some papers on his desk, already seeming to lose interest in the case. The fine for this violation is $300, due within 30 days. Sarah's heart sank. $300 was a significant amount, especially considering the limited funding her community health program received. That money could have provided basic medical supplies for several elderly patients. Your Honor, would it be possible to? That will be all, Ms. Johnson, Judge Thompson said firmly, already looking at the next case file. Please see the clerk to arrange payment. Next case. As Sarah turned to leave the podium, she caught a glimpse of something in the judge's expression, not quite disdain, but something close to it. It was a look she had seen before in her work, the look of someone who had already made up their mind without hearing the full story. Walking back through the courtroom, Sarah held her head high, despite the weight of the fine and the sting of dismissal. She thought of Mrs. Williams and the dozens of other patients who relied on her help to navigate the complex healthcare system. The fine would hurt, but it wouldn't stop her from doing what she knew was right. Little did either of them know that this brief courtroom encounter was just the beginning of a story that would challenge both their perspectives and change their community forever. Later that afternoon, Sarah sat in her small office at the Community Health Access Center, staring at the yellow citation paper on her desk. The $300 fine might as well have been $3,000. The money would have to come from her own pocket, since she couldn't use the clinic's limited funds for a personal parking ticket. The office around her told the story of her dedication. The walls were covered with thank you cards from patients, many written in shaky handwriting by elderly hands. Stacks of medical assistance applications and insurance forms covered every surface, each representing someone in need of help. A small fan hummed in the corner, pushing around the warm spring air since the building's air conditioning rarely worked properly. Her phone buzzed, displaying Mrs. Williams' name on the screen. Sarah took a deep breath before answering. "Hello, Mrs. Williams." "Sarah, dear, I just heard what happened at the courthouse." Mrs. Williams' voice trembled with concern. "My neighbor's daughter works there as a clerk. I feel terrible that you got fined because of me." "Please don't worry about it," Sarah replied, trying to keep her voice cheerful. "What matters is that we got your diabetes medication sorted out that day." But after hanging up, Sarah allowed herself a moment of frustration. She opened her personal banking app and looked at her account balance. Between her student loan payments, the rent for her modest apartment, and the money she often spent buying medical supplies for patients who couldn't afford them, her savings were already stretched thin. The sound of footsteps made her look up. Dr. James Chen, the clinic's senior physician, stood in her doorway with a concerned expression. At 60, he had been serving the community for over 3 decades and had become something of a father figure to Sarah. "I heard about what happened in court," he said softly, entering her office and sitting in the worn chair across from her desk. "That Judge, Thompson, he has a reputation for being inflexible." Sarah straightened some papers on her desk, trying to maintain her composure. "It's not just about the money, Dr. Chen." He didn't even try to understand. To him, I was just another person breaking the rules. Dr. Chen nodded thoughtfully. "You know, when I started this clinic 30 years ago, we faced similar challenges. The system isn't built to understand the realities of community healthcare." Sarah stood up and walked to her window, looking out at the busy street below. The clinic was located in one of the city's poorest neighborhoods, where many residents struggled to access basic medical care. She watched as an elderly man slowly made his way up the clinic's steps, leaning heavily on his cane. "Next week, I have to help Mr. Rodriguez get to his cancer treatment," she said, turning back to Dr. Chen. "The hospital is 3 bus rides away, and he can barely walk. What if there's no parking again? Do I just leave him there?" Dr. Chen stood up and placed a supportive hand on her shoulder. "You do what you've always done, whatever it takes to help people in need. We'll figure out the money somehow." Just then, Sarah's office phone rang. It was the receptionist, telling her that 3 new patients had arrived, all needing help with insurance paperwork. Sarah quickly wiped her eyes and gathered her files. "Back to work," she said with a small smile. "These forms won't fill themselves out." As she walked to the waiting room, Sarah thought about Judge Thompson in his pristine courtroom, so far removed from the daily struggles of her patients. She wondered if he had ever had to choose between following the rules and helping someone in desperate need. The waiting room was crowded, as usual. An elderly woman sat clutching a stack of confusing medical bills. A young mother tried to calm her crying baby while filling out forms. A middle-aged man in a worn work uniform waited patiently, probably using his lunch break to seek help. Looking at their faces, Sarah felt her determination return. The fine would hurt, but it was just another obstacle to overcome. She had chosen this path knowing it wouldn't be easy. Taking out her notebook, she called the first patient's name and pushed thoughts of Judge Thompson and his courtroom to the back of her mind. Little did she know that at that very moment, across town in his chambers, Judge Thompson was about to discover something that would change everything. Judge Michael Thompson sat in his private chambers, enjoying his usual afternoon coffee while reviewing the day's cases. The late afternoon sun cast long shadows through the Venetian blinds, creating strips of light across his mahogany desk. His assistant, Linda Martinez, entered with a stack of local newspapers she always brought him to review community matters. "Your Honor," Linda said, placing the papers on his desk, "I thought you might want to see today's feature article in the City Herald." Thompson nodded absently, barely looking up from his case files. After 30 years on the bench, most days blended together in a parade of traffic violations, minor offenses, and municipal disputes. But as he reached for his coffee cup, the headline on the front page caught his eye. "Local hero, the guardian angel of Oakland's healthcare system." His hand froze midair. There, spread across the front page, was a clear photograph of Sarah Johnson, the same woman he had found that morning. In the picture, she was helping an elderly man in a wheelchair navigate a hospital entrance, her face showing the same determination he had seen in his courtroom. "Linda," he called out, his voice slightly unsteady. "Was this woman in my courtroom this morning?" Linda walked back to his desk and looked at the article. "Yes, Your Honor. The parking violation case. I actually heard some of the courthouse staff talking about it during lunch. They say she's quite well known in the community." Judge Thompson began reading the article, his coffee forgotten. Sarah Johnson could have chosen an easy path. With her healthcare administration degree and impressive credentials, she could be making six figures at any private hospital. Instead, she chose to become a guardian angel for Oakland's most vulnerable residents. Working 60-hour weeks at the Community Health Access Center, Johnson has helped over 3,000 elderly and disabled patients navigate the complex healthcare system. She often uses her own car to transport patients who can't afford ambulances, helps them fill out complicated insurance forms, and advocates for their care at hospitals. "Without Ms. Johnson, I wouldn't be alive today," says Dorothy Williams, 82, who suffers from severe diabetes. "When I couldn't afford my insulin, she found a program to cover the costs. When I can't get to my appointments, she makes sure I get there safely." The judge's hands tightened on the paper as he recognized Mrs. Williams' name from that morning's case. He continued reading. "Johnson recently established a free medication delivery service for homebound patients and created a network of volunteer drivers to help patients reach medical appointments. Her innovative programs have caught the attention of state healthcare officials who are considering implementing her model across other districts." "Sarah works miracles with almost no resources," says Dr. James Chen, senior physician at the Community Health Access Center. "She spends her own money on patient supplies, works weekends, and never turns anyone away. The system puts up barriers, but she finds ways around them to save lives." Judge Thompson set down the paper and removed his glasses, rubbing his temples. The article continued with more stories of Sarah's work, each one making him feel increasingly uncomfortable about their morning interaction. "Linda," he called out again, "can you pull the file from Ms. Johnson's case this morning?" As Linda brought him the file, he noticed her hesitation. "Is there something else?" he asked. "Well, Your Honor," she said carefully, "my mother volunteers at that clinic. She says Ms. Johnson often helps patients in the middle of the night during medical emergencies. Apparently, she keeps a sleeping bag in her office because sometimes she works such long hours." Judge Thompson opened the case file and stared at the parking ticket photo. The restricted zone where Sarah had parked was just a few feet from the clinic's entrance. In the photo, he could see a wheelchair ramp nearby. He thought about how quickly he had dismissed her explanation, how he hadn't really looked at her until now. The weight of his hasty judgment settled uncomfortably in his stomach. "Your Honor," Linda's voice interrupted his thoughts. "The afternoon session starts in 10 minutes. Thompson nodded, but his mind was elsewhere. For the first time in years, he found himself questioning whether justice had truly been served in his courtroom that morning. That evening, Judge Thompson did something he hadn't done in his 30 years on the bench. He drove to the scene of a parking violation. The Community Health Access Center stood on a busy corner, its brick walls weathered by time. The setting sun cast an orange glow over the "Serving Our Community Since 1985" sign above the entrance. He parked his Mercedes across the street, noticing immediately how different this area was from his usual downtown route. The sidewalks were cracked, and the streetlights flickered uncertainly. A steady stream of people still entered and exited the clinic, even at this late hour. As he watched, an elderly woman with a walker struggled up the clinic steps. A familiar figure in a blue blazer rushed out to help her, Sarah Johnson. Even after a full day's work, she moved with the same energy he had seen in his courtroom that morning. Thompson got out of his car and walked closer, staying in the shadows of a nearby building. He could now clearly see the parking situation that had brought Sarah to his courtroom. The clinic had only 3 designated parking spots, all currently occupied by cars with handicap permits. The nearest public parking was indeed 2 blocks away, up a steep hill. Just then, a beat-up minivan pulled up to the restricted zone, the same spot where Sarah had parked earlier. A middle-aged man jumped out, helping an elderly woman who was clearly having trouble breathing. Sarah appeared again, this time with a wheelchair. Mr. Rodriguez, is your mother's inhaler acting up again? She called out, quickly helping the woman into the wheelchair. Yes, Miss Sarah, the man replied anxiously. I know we're not supposed to park here, but... Don't worry about that right now, Sarah assured him, already wheeling his mother toward the entrance. Let's get her inside first. Thompson watched as they disappeared into the clinic. The man's van remained in the restricted zone, just as Sarah's car had that morning. The judge found himself checking his watch, counting the minutes until they returned. Curious about what else he might learn, he walked around the block. Behind the clinic, he discovered a small parking lot filled with older cars. Through a ground floor window, you could see into what must be Sarah's office. She was there, still in her blazer, surrounded by stacks of papers as she worked at her desk. A sleeping bag was rolled up in the corner, confirming what his assistant had told him. On the office wall, Thompson could make out a large whiteboard covered with names and dates, some kind of scheduling system. Even from outside, he could see how many slots were filled. Next to the whiteboard hung a map of the city with dozens of pins marking what he assumed were patients' homes. As he stood there, a police car cruised slowly past the clinic. The officer inside gave a friendly wave to Sarah through the window. Thompson realized the local police must be well aware of the parking situation, but chose to look the other way, understanding the necessity of what happened here. He walked back to the front just as Mr. Rodriguez and his mother emerged from the clinic. The elderly woman was breathing normally now, clutching a new inhaler. The entire episode had taken exactly 17 minutes. Remember, Mrs. Rodriguez, Sarah called from the doorway, 2 puffs every 4 hours, and call me if anything changes. I'll check on you tomorrow. As the van pulled away, Thompson noticed Sarah making a note in a small notebook she carried. He wondered how many other similar incidents she handled each day, how many other parking violations she risked to help people in crisis. Back in his car, the judge sat for a long moment, thinking about the scene he had just witnessed. The Sarah Johnson he had dismissed so quickly in his courtroom was clearly at the center of a vital community service network. His fine wasn't just punishing her, it was potentially hampering her ability to help people who desperately needed it. He picked up his phone and called Linda, his assistant. I need you to pull every similar parking violation from this area for the past year, he said. And get me in touch with the city's transportation department first thing in the morning. As he drove home through the darkening streets, Judge Thompson realized that sometimes justice required looking beyond the letter of the law to see the bigger picture. The question was, what was he going to do about it? Judge Thompson sat in his office early the next morning, surrounded by stacks of files and reports. He had barely slept, his mind troubled by what he had witnessed at the clinic. Linda had arrived to find him already reviewing a year's worth of parking violations in the clinic's area. Your Honor, Linda said, placing a fresh cup of coffee on his desk, I have that information you requested about similar cases. The judge nodded, picking up another file. His reading glasses sat low on his nose as he studied the patterns emerging from the data. In the past year, there had been 37 parking violations in that same spot. Looking closer, he noticed something interesting. They'd all occurred during the clinic's operating hours, and many involved vehicles registered to elderly or disabled residents. Linda, he called out, do we have any photographs from these other violations? She brought over a stack of parking enforcement photos. In several of them, you could see wheelchairs, walkers, and people being helped into the clinic. Each photo told a similar story to Sarah's case. As he studied the evidence, memories from his own past began to surface. 20 years ago, his mother had struggled with getting to her medical appointments after his father passed away. Thompson had been too busy building his career to help much, always assuming she would find a way to manage. Now he wondered, had there been a Sarah Johnson in his mother's neighborhood? Someone who could have made her final years easier. The phone on his desk rang, interrupting his thoughts. It was Robert Martinez, the city's transportation director, returning his call. Judge Thompson, Martinez said, I understand you're inquiring about the parking situation near the Community Health Access Center. Yes, Thompson replied, straightening in his chair. I'm concerned about the impact of our current restrictions on patient access. There was a pause on the line. Actually, Judge, we've been aware of this issue for some time. We've had multiple requests to modify the parking rules there, but they've been stuck in bureaucratic red tape, without someone of influence pushing for change. Thompson's pen tapped thoughtfully on his desk. And what would it take to unstick this particular piece of red tape? Well, Martinez said carefully, a formal recommendation from a city judge would carry significant weight. After ending the call, Thompson sat back in his leather chair, looking out his window at the courthouse steps below. He thought about how many times he had sentenced people without truly understanding their circumstances. How many other Sarah Johnsons had stood before him, their stories unheard. Linda knocked softly on his door again. "Your Honor, I have something else you might want to see." She handed him a small stack of handwritten letters. "What are these?" he asked, putting his glasses back on. "These arrived over the past few months. They're thank you letters from people Ms. Johnson has helped. They were sent to various city offices, including the courthouse." Thompson began reading. Each letter told a story of compassion and dedication. An 85-year-old veteran who could finally get his heart medication. A single mother whose child received emergency care during an asthma attack. A homeless man who got dental surgery after years of pain. One letter in particular caught his eye. It was from Dorothy Williams, the same elderly woman involved in Sarah's parking violation. "I don't know what our community would do without Ms. Johnson. When my husband died last year, I was lost in a maze of medical bills and appointments. She spent hours helping me understand everything, even coming to my house on Sundays. She never asks for anything in return. The world needs more people like her." Thompson set the letters down and removed his glasses, rubbing his eyes. He had spent 3 decades building a reputation as a strict interpreter of the law. But now he realized that sometimes the strictest interpretation of the law could result in the greatest injustice. He pressed the intercom button. "Linda, please clear my afternoon schedule and find out if Ms. Johnson is working at the clinic today. I think it's time I paid her an official visit." The morning sun had fully risen now, streaming through his window and illuminating the scattered papers on his desk, each one a small piece of the larger truth he had been too blind to see. Sarah was helping an elderly patient fill out insurance forms when she heard excited whispers from the clinic's waiting room. Looking up, she saw something completely unexpected. Judge Thompson walking through the front door, wearing his usual formal suit, but looking somehow different from the stern figure she faced in court. The regular sounds of the busy clinic fell silent. Patients and staff watched curiously as the judge approached the front desk, his footsteps echoing in the sudden quiet. The receptionist, Maria, looked at Sarah with wide eyes, silently asking what to do. "It's okay, Maria," Sarah said, standing up from her desk. "I'll handle this." She walked toward the judge, trying to hide her surprise and concern. Was there some problem with her fine? Had she missed a deadline? But the expression on Judge Thompson's face wasn't stern or angry. If anything, he looked uncomfortable. "Ms. Johnson," he said, his voice gentler than it had been in court. "I wonder if we might speak privately." Sarah led him to her small office, aware of all the eyes following them. The judge looked around the cramped space, taking in the overflowing filing cabinets, the wall of patient thank you cards, and the sleeping bag in the corner. His eyes lingered on the large scheduling board with its dozens of patient names and appointments. "Please, have a seat, Your Honor," Sarah said, clearing some papers from the only other chair in the room. Through her window, she could see several of her regular patients pressing their faces against the clinic's front window, watching with concern. Judge Thompson sat down, then surprised her by removing his glasses and placing them on her desk. Without them, his face looked softer, more human. "Ms. Johnson, I owe you an apology," he said quietly. Sarah blinked, unsure she'd heard him correctly. The judge continued, "I've spent the last day learning about your work here, about what you do for this community. I was wrong to dismiss your explanation so quickly in court." Before Sarah could respond, a knock at her door interrupted them. It was Mrs. Rodriguez, the woman from the previous evening with the breathing problems. "Oh, I'm sorry, Miss Sarah, but I just wanted to thank you again for last night." She stopped short when she saw Judge Thompson. The judge stood up, looking at Mrs. Rodriguez with interest. "Ma'am, would you mind telling me about your experience with Ms. Johnson?" Mrs. Rodriguez's face lit up. "Miss Sarah? She's an angel. Last night when my inhaler wasn't working, my son parked in the no parking zone because I couldn't walk far. Miss Sarah helped me right away. If we had to park far away..." She shook her head, touching her chest at the memory. The judge nodded thoughtfully. More patients had gathered in the hallway, and soon Sarah's small office was crowded with people wanting to share their stories. Mr. Chen arrived and stood in the doorway, watching with a slight smile as patient after patient spoke about how Sarah had helped them. She drove me to my cancer treatments when I had no one else. She helped me understand my Medicare forms. She visits my mother every Sunday to check her medications. Judge Thompson listened to each story, his face growing more thoughtful with each testimony. Finally, he held up his hand and turned back to Sarah. "Ms. Johnson, I came here today not just to apologize, but to make things right. I've spent my career focusing on the letter of the law, but I've learned that justice sometimes requires us to look deeper." He reached into his briefcase and pulled out some official-looking papers. "I drafted a proposal for the City Transportation Department to create designated medical loading zones in front of all community health centers. Until that's approved, I'm dismissing your fine and issuing a special permit for your work." Sarah felt tears forming in her eyes but held them back. "Thank you, Your Honor. This will help so many people." The judge stood up, looking around at the grateful faces surrounding them. "No, Ms. Johnson, thank you. You taught me an important lesson about true justice." He picked up his glasses and put them back on, but his eyes were noticeably warmer now. "I think this community is fortunate to have someone who cares enough to risk a parking ticket to help others." As Judge Thompson prepared to leave, the waiting room erupted in applause. Sarah watched him walk toward the door, noticing how different he looked now, less like the stern judge from the courtroom and more like someone who had finally opened his eyes to see the real world around him. 2 weeks after Judge Thompson's visit to the clinic, the changes he promised began to take shape. Workers in bright yellow vests were installing new signs outside the Community Health Access Center, marking 4 dedicated spaces as medical loading zone, 45-minute limit. Sarah watched from her office window as they painted fresh blue lines on the pavement. The local newspaper had printed another story, this time with a photo of Judge Thompson and Sarah standing together outside the clinic. The headline read, "Local judge partners with healthcare hero to improve community access." The article detailed the new parking program and mentioned how it would be implemented at other medical facilities across the city. Dr. Chen walked into Sarah's office, holding the newspaper. "Have you seen this?" he asked with a smile. "They're calling you a healthcare hero again." Sarah shook her head modestly. "The real story here is Judge Thompson. Not many people in his position would admit they were wrong and work to fix things." Just then, they heard a commotion from the waiting room. Mrs. Williams had arrived for her weekly diabetes checkup, but this time she wasn't alone. Several other elderly residents from her apartment complex had come with her, all needing medical help but having been too afraid of the parking situation to come before. "Miss Sarah," Mrs. Williams called out excitedly. "Look who I brought." They'd all saw the new parking spaces, and I told them about how you help people here. Sarah stepped out to greet the new patients, noticing how they could now easily park their cars right in front of the clinic. No more long walks, no more risking tickets, no more choosing between healthcare and following parking rules. Later that afternoon, Sarah received an unexpected call from the mayor's office. The mayor had read about the parking changes and wanted to discuss expanding the program even further. She was interested in creating a citywide task force to identify other barriers to healthcare access, and she wanted both Sarah and Judge Thompson to lead it. "We need people who understand both the law and the real-world challenges our citizens face," the mayor explained. "Your partnership with Judge Thompson has shown us how much can be accomplished when we bridge that gap." After the call, Sarah sat at her desk, looking at the growing pile of patient files. Each folder represented someone who needed help navigating the complex healthcare system. But now, instead of feeling overwhelmed, she felt hopeful. The parking solution was just the beginning. Her phone buzzed with a text message from Judge Thompson. "Meeting with City Council tomorrow about healthcare access zones. Would appreciate your input. Can you attend?" Sarah smiled as she typed her reply. In the past few weeks, the judge had become a powerful ally in her mission to help the community. He had even started visiting the clinic regularly, sitting in the waiting room and talking with patients to better understand their challenges. As the afternoon sun cast long shadows through her window, Sarah heard a familiar voice from the front desk. It was Mr. Rodriguez, bringing his mother for her follow-up appointment. This time, they pulled right into one of the new parking spaces, no anxiety about where to park or fear of getting a ticket. Dr. Chen appeared in her doorway again. "Sarah, you won't believe this. 3 other community clinics called today. They want to learn about our patient advocacy program. They're asking if you can help them set up something similar." Sarah looked at her scheduling board, now even fuller with new patients who had previously been unable to reach the clinic. The sleeping bag was still in the corner, but she hadn't needed to use it as much lately. With the new changes, things were running more smoothly. A knock on her office window made her look up. Judge Thompson was walking from his car to the clinic's entrance, carrying what looked like more official papers. But this time, Sarah wasn't worried. She knew that whatever changes were coming next would be for the better. The community was changing, one small victory at a time, and it all started because a judge took the time to look beyond his bench and see the real-world impact of his decisions. 6 months after the parking ticket incident, the Community Health Access Center hosted a special ceremony in its newly renovated community room. The space was packed with patients, medical staff, city officials, and local reporters. At the front of the room, Sarah Johnson and Judge Michael Thompson stood together, preparing to announce the launch of the city's new healthcare access initiative. The mayor stepped up to the podium, smiling at the crowd. 6 months ago, a parking ticket brought 2 unlikely allies together. Today, we're seeing how that small incident has transformed our entire community's approach to healthcare access. Sarah looked out at the familiar faces in the audience. Mrs. Williams sat in the front row, beaming proudly. Next to her was Mr. Rodriguez and his mother, both looking healthier than ever. Even Linda, Judge Thompson's assistant, had come to show her support. The changes over the past months have been remarkable. The medical loading zones, first tested at Sarah's clinic, had now been implemented at 20 healthcare facilities across the city. But that was just the beginning. Judge Thompson stepped forward to speak. He looked different now, more approachable, more connected to the community he served. "When I fined Ms. Johnson that day in court, I thought I was upholding the law," he said, his voice carrying through the room. "Instead, I was about to learn the most important lesson of my 30-year career." He gestured to the large map on the wall showing the new healthcare access zones throughout the city. "Thanks to Ms. Johnson, I learned that true justice isn't just about following rules. It's about understanding why those rules sometimes need to change." Sarah walked to the podium next, carrying the original parking ticket in her hand. She had framed it, and now it would hang in the clinic's lobby as a reminder of how change could start from the smallest moments. "This ticket," she said, holding it up, "could have been just another barrier between our patients and their health care. Instead, it became a bridge." She turned to smile at Judge Thompson. Sometimes the most unlikely partnerships create the biggest changes. The audience applauded as Sarah and the judge unveiled the new city program. Based on Sarah's work at the clinic, every hospital and medical center would now have patient advocates to help people navigate the healthcare system. Special transportation services would be provided for elderly and disabled patients. The parking zones were just the first step in a larger plan to make healthcare accessible to everyone. Dr. Chen stood up to make a surprise announcement. "Thanks to Judge Thompson's advocacy, the state has approved funding for 5 new community health centers based on our model. And," he paused, grinning at Sarah, "they want Ms. Johnson to help train the staff." Sarah felt tears in her eyes as she looked around the room. Her small office with the sleeping bag seemed like a distant memory now. The clinic had grown, added staff, and helped more people than she had ever thought possible. After the ceremony, as people mingled and celebrated, Judge Thompson pulled Sarah aside. "You know," he said quietly, "I still keep that newspaper article about you in my chambers. It reminds me to look beyond the surface of every case that comes before me." Sarah nodded, thinking about how much had changed. "And I keep that parking ticket framed on my wall to remind me that sometimes the biggest obstacles can become the greatest opportunities." Outside, the sun was setting over the city. The new medical loading zone signs gleamed in the evening light, their blue paint a beacon of hope for anyone needing help. A steady stream of people entered and left the clinic, each one able to access the care they needed without fear or difficulty. As Sarah watched them, she remembered something Dr. Chen had said months ago. The system isn't built to understand the realities of community healthcare. Now, finally, that was changing. One parking ticket had started a revolution in how their city approached healthcare access. Judge Thompson stood beside her, both of them watching the community they had helped transform. You know, Ms. Johnson, he said with a smile, sometimes justice wears a black robe, and sometimes it wears a blue blazer with a medical bag. Sarah laughed, thinking about how a simple parking violation had led to all this. It was proof that when people took the time to understand each other's perspectives, real change was possible.